From nutrition and fitness to mental well-being, our goal is to help you live your healthiest life. Subscribe now for easy-to-follow tips and updates that can make a real difference in your daily routine. Let's start this journey to better health together. In this video, we talk about early signs of prostate problems you shouldn't ignore. Let's dive deeper into each of the early signs of prostate problems, explaining the underlying causes, associated risks, and why they are significant. 1. Frequent urination. What it means. Frequent urination, particularly at night, is a common symptom of an enlarged prostate, medically known as benign prostatic hyperplasia, BPH. The prostate gland surrounds the urethra, and as men age, the prostate often enlarges. This enlargement can press against the urethra, narrowing the passage through which urine flows. As a result, the bladder has to work harder to push urine through, leading to more frequent urges to urinate. Why it's concerning. While frequent urination may seem like a minor inconvenience, it can significantly impact your quality of life, disrupting sleep and daily activities. Over time, if BPH is left untreated, it can lead to urinary retention, where the bladder cannot empty completely. This increases the risk of urinary tract infections, UTIs, bladder stones, and even kidney damage due to back pressure on the kidneys. 2. Difficulty starting urination. What it means. Difficulty starting urination, also known as hesitancy, occurs when the muscles in the bladder or the urethra don't work as efficiently, often due to pressure from an enlarged prostate. You may find yourself straining to start the flow of urine, or there may be a delay between the urge to urinate and the start of the urine flow. Why it's concerning. Hesitancy can lead to incomplete bladder emptying, which means some urine remains in the bladder after you finish urinating. This residual urine can become a breeding ground for bacteria, leading to frequent urinary tract infections. In severe cases, it can cause bladder damage and increase the risk of bladder stones. 3. Pain or burning during urination. What it means. Pain or a burning sensation during urination, dysuria, often points to an infection or inflammation of the prostate, known as prostatitis. Prostatitis can be caused by bacterial infections, but in many cases, the exact cause remains unknown. The inflammation can irritate the bladder and urethra, leading to discomfort during urination. Why it's concerning. Ignoring pain or burning during urination can lead to chronic prostatitis, a condition that can be difficult to treat and may cause ongoing discomfort. Chronic prostatitis can also affect sexual function and overall well-being. If the pain is due to an untreated infection, it could spread to other parts of the urinary tract or cause more severe complications. 4. Blood in urine or semen. What it means. Blood in the urine, hematuria, or semen, hematospermia, can be alarming. While it may result from something benign like a minor infection or inflammation, it can also be a sign of something more serious, such as prostate cancer, a severe infection, or kidney stones. The blood may appear as a pink, red, or brownish tinge in the urine or semen. Why it's concerning. While blood in the urine or semen does not always indicate a serious condition, it should never be ignored. 5. Pain in the pelvic area, lower back, or hips. What it means. Persistent pain in the pelvic region, lower back, or hips can sometimes be linked to prostate issues, particularly advanced prostate cancer. Prostate cancer can metastasize, spread, to the bones, leading to chronic pain in these areas. Prostatitis, too, can cause pain in the lower back or pelvic area due to inflammation. Why it's concerning. Pain in these areas that persists over time, especially if it's not related to physical activity or injury, should be evaluated by a healthcare provider. If the pain is due to metastatic prostate cancer, early treatment is crucial for managing the disease and reducing pain. Additionally, chronic pain can significantly affect your quality of life and may indicate the need for comprehensive medical evaluation and treatment. 6. Erectile dysfunction. What it means. Erectile dysfunction, ED, or the inability to achieve or maintain an erection, can sometimes be a sign of prostate problems. The nerves and blood vessels necessary for an erection are closely related to the prostate gland. Conditions like BPH, prostatitis, or prostate cancer can affect these structures, leading to ED. Why it's concerning. ED can have a significant impact on a man's self-esteem, relationships, and overall quality of life. Moreover, it may indicate an underlying health issue that needs to be addressed, such as prostate disease or cardiovascular problems. Since the same blood vessels that supply the prostate also supply the penis, ED can sometimes be an early warning sign of systemic vascular issues. 7. Painful ejaculation. What it means: painful ejaculation can be associated with prostatitis, an inflammation of the prostate gland, which can cause discomfort during or after ejaculation. It may also be a symptom of chronic pelvic pain syndrome, CPPS, which affects the prostate and surrounding areas. Why it's concerning? This symptom can lead to a reduced interest in sexual activity and can negatively affect sexual relationships. 8. Reduced urine flow. What it means: a reduced or weak urine stream is a hallmark sign of BPH. As the prostate enlarges, it compresses the urethra, narrowing the passage through which urine flows. This results in a weaker stream, sometimes described as dribbling or feeling like you're not getting everything out. Why it's concerning? A reduced urine flow can make it difficult to fully empty the bladder, leading to urinary retention. This condition can cause bladder stretching, damage to the bladder muscles, and increase the risk of urinary tract infections. In extreme cases, it could require surgical intervention to relieve the obstruction. 9. Urinary incontinence. What it means: urinary incontinence, or the involuntary leakage of urine, can occur due to several prostate-related issues. An enlarged prostate can cause overflow incontinence, where the bladder doesn't empty fully and overflows. It can also be a result of weakened bladder muscles or nerve damage from advanced prostate disease. Why it's concerning? Incontinence can be embarrassing and significantly affect daily life. It can also indicate more severe underlying conditions, such as nerve damage or significant bladder dysfunction, that require prompt medical evaluation and treatment. Addressing incontinence early can help manage symptoms and prevent complications like skin irritation or infections. 10. Feeling of incomplete emptying. What it means: a constant feeling that your bladder hasn't completely emptied after urination is a common symptom of BPH. This occurs because the enlarged prostate obstructs the flow of urine, preventing the bladder from fully emptying. Why it's concerning? Incomplete bladder emptying can lead to chronic urinary retention, increasing the risk of urinary tract infections, bladder stones, and even kidney damage. Over time, the bladder muscles can weaken, making it even harder to empty the bladder completely. This symptom should be evaluated by a healthcare provider to prevent further complications. When to see a doctor. If you experience any of these symptoms, it's crucial to seek medical advice. Prostate issues, particularly BPH and prostate cancer, are more common as men age, but early detection and treatment can significantly improve outcomes. Regular prostate screenings, such as a prostate-specific antigen, PSA, blood test, or a digital rectal exam, DRE, are recommended for men over the age of 50 or earlier if you have risk factors such as a family history of prostate cancer. Early detection not only helps in managing symptoms more effectively, but also in preventing the progression of potentially serious conditions. Treatment options. If you're diagnosed with a prostate condition, several treatment options are available, depending on the specific problem. 1. Medications. For BPH, alpha blockers, such as tamsulosin, can relax the muscles of the prostate and bladder neck to improve urine flow. 5-alpha reductase inhibitors, such as finasteride, can shrink the prostate over time. For prostatitis, antibiotics are used for bacterial prostatitis. Anti-inflammatory medications and alpha blockers may be prescribed for chronic prostatitis. For erectile dysfunction, PDE5 inhibitors, such as sildenafil, can help with erectile dysfunction, particularly if it's related to prostate conditions. 2. Minimally invasive procedures. For BPH, techniques like transurethral resection of the prostate, TURP, or laser therapy can remove part of the prostate to relieve symptoms. For prostate cancer, options include brachytherapy, radioactive seed implants, or cryotherapy, freezing prostate tissue. 3. Surgery. For BPH, prostatectomy, removal of part or all of the prostate, may be necessary if symptoms are severe and other treatments are ineffective. Thank you for being a part of our health community. While this is our final episode, the journey to better health never ends. Stay informed, stay active, and keep taking care of yourself. Remember, your health is your wealth. Don't forget to subscribe my channel. Goodbye for now, and take care.